Welcome to Blood Sugar Squad, your go-to channel for simple, actionable tips to manage diabetes and live your best life. Living with diabetes is a journey of daily management. We focus on numbers, meals, and medications, and it's easy to get caught in the day-to-day. But we must also understand the destination we're steering toward. The reason we check our sugars and count our carbs isn't just for today's feeling. It's to protect our future selves from serious, long-term complications. The truth is, persistently high blood sugar is like a slow, corrosive tide, damaging the most delicate systems in our body over time. But here's the powerful part. This damage is largely preventable. Knowledge is your first line of defense. So today, we're counting down the 5 most dangerous diabetes complications, starting from number 5 and working our way to the most critical. For each one, we'll break down what it is, why it happens, and most importantly, the actionable steps you can take right now to avoid it. Number 5. Nerve damage, diabetic neuropathy. We begin with a complication that often starts silently, with a subtle whisper you might miss. Diabetic neuropathy, or nerve damage, occurs when high blood sugar and high levels of fats in the blood, like triglycerides, injure the tiny walls of the capillaries that nourish your nerves, particularly in your legs and feet. Think of your nerves as electrical wiring. This damage shorts out the signals. You might start to feel tingling, burning, numbness, or sharp pains, usually starting in the toes and creeping upward. But the danger isn't just the discomfort. That loss of sensation is the real threat. A small pebble in your shoe, a blister from new shoes, or a minor cut can go completely unnoticed. Without pain to signal a problem, a simple wound can become infected, ulcerate, and in severe cases, lead to dire consequences we'll discuss later. So, how do you avoid it? The strategy is twofold: aggressive defense and diligent detection. First, your primary weapon is consistent blood sugar management. Keeping your glucose levels in your target range is the single most effective way to slow or prevent nerve damage. Second, you must become a daily detective of your own feet. Make a thorough foot inspection part of your routine, like brushing your teeth. Use a mirror to see the bottoms, check between your toes, and feel for any changes in temperature, texture, or skin integrity. Always wear protective footwear, even indoors. And see your doctor immediately if you notice any changes, no matter how small. Protecting your nerves is about preserving your connection to the world. Number 4. Kidney disease, diabetic nephropathy. Moving inward to a vital filtration system, we come to kidney disease, or nephropathy. Your kidneys are intricate filters containing millions of tiny blood vessels called glomeruli. Chronically high blood sugar and high blood pressure put immense strain on these delicate filters. Over time, they become scarred and leaky. They start to spill precious protein, primarily albumin, into your urine, a key early warning sign. As the damage progresses, the kidney's ability to filter waste from your blood diminishes, leading to a dangerous buildup of toxins. In its final stages, it can result in kidney failure, requiring dialysis or a transplant. So, how do you avoid it? The mantra here is control and check. Blood sugar control is, again, foundational. But equally critical is managing your blood pressure, as hypertension is a major accomplice in kidney damage. Work with your doctor to keep both numbers in a healthy range. The most crucial avoidance tactic, however, is regular screening. A simple urine test called the urine albumin to creatinine ratio, UACR, and a blood test for your estimated glomerular filtration rate, eGFR, can detect kidney problems in their earliest, most treatable stages, often years before you feel any symptoms. Ask for these tests at least once a year. Protecting your kidneys means committing to these simple screenings without fail. Number 3. Eye damage, diabetic retinopathy. At number 3 is a complication that threatens one of our most precious senses, our sight. Diabetic retinopathy damages the retina, the light-sensitive tissue at the back of the eye. High blood sugar causes the tiny, fragile blood vessels in the retina to swell, leak, or become blocked. In response, the eye may start growing new, abnormal blood vessels. These new vessels are weak and prone to bleeding into the vitreous gel of the eye, causing floaters, dark streaks, and if scar tissue forms, it can pull on the retina and cause detachment. The terrifying part? In its early stages, diabetic retinopathy often has no symptoms at all. Vision may seem perfect until the damage is severe and sudden. So, how do you avoid it? Beyond diligent blood sugar and blood pressure control, your absolute non-negotiable shield is the annual dilated eye exam. This is not a standard vision check for glasses. A specialist will use drops to widen your pupils and examine the health of your retina directly. This exam can detect retinopathy long before you notice any vision changes, allowing for early intervention with lasers or injections that can halt progression and save your sight. Consider this exam a yearly mandatory meeting to protect your vision. Do not skip it. Number 2. Cardiovascular disease, heart attack and stroke. We now arrive at one of the leading causes of mortality for people with diabetes: cardiovascular disease. Diabetes doesn't just affect your blood sugar. It creates a perfect storm for your heart and blood vessels. High glucose levels contribute to the formation of fatty deposits, or plaques, inside the walls of your arteries, a process called atherosclerosis, a specific type of arteriosclerosis. This makes your arteries stiff, narrow, and prone to inflammation. If a plaque in an artery supplying your heart ruptures, it causes a heart attack. If it happens in an artery to your brain, it causes a stroke. The insidious truth is that people with diabetes often have silent heart issues with less noticeable warning signs. So, how do you avoid it? This requires a full-spectrum approach. Yes, blood sugar management is critical, but it's only one part of the ABC defense strategy. A is for your A1C, keeping it in range. B is for blood pressure, managing it aggressively. C is for cholesterol, specifically keeping your bad LDL cholesterol low. This trio works together. Add to this the non-negotiable habits: not smoking, engaging in regular aerobic exercise, like brisk walking, to strengthen your heart, and eating a heart-healthy diet low in saturated fats, trans fats, and sodium. Protecting your cardiovascular system is about protecting the very core of your life. Number 1. Severe foot complications and amputation. The most dangerous complication we must discuss is severe foot complications leading to amputation. This is not a standalone issue. It is the catastrophic convergence point of all the complications we've already discussed. It starts with neuropathy, the loss of feeling in your feet. Add to that poor circulation from cardiovascular disease, which slows healing. A minor, unnoticed injury, combined with a reduced immune response common in diabetes, leads to a severe infection. That infection can spread to bone, becoming osteomyelitis. When antibiotics and wound care cannot control the infection, and it threatens your life, amputation becomes a necessary, life-saving procedure. This is the domino effect of uncontrolled diabetes in its most devastating form. So, how do you avoid it? The avoidance strategy for this is the sum total of everything we've covered, with extreme vigilance focused on your feet. You prevent neuropathy through glucose control and daily foot checks. You support circulation through heart-healthy habits, blood pressure, and cholesterol management. You must treat any foot injury as a medical emergency. See a podiatrist regularly. Never go barefoot. Wear properly fitted shoes. Inspect, inspect, inspect. Avoiding amputation is the ultimate testament to proactive, comprehensive diabetes care. It is the strongest reason why the daily management we do matters so profoundly. Now, building a strong defense against these complications starts with a solid plan. And a crucial part of that plan is your diet. So, we've created a free resource for you: Mindful Eating for Diabetics. This isn't a restrictive diet. It's a practical guide that's your first actionable step toward the prevention strategies we just discussed. To download your free copy, just scan the QR code on your screen or click the link in the description below. It's our gift to help you turn knowledge into daily action. Hearing this list can feel overwhelming, even frightening. But please, let's reframe this. This knowledge is not given to scare you, but to empower you. Every single complication we discussed today shares one common, powerful trait: they are largely preventable. They are not inevitable consequences of a diabetes diagnosis. They are potential outcomes of unmanaged diabetes. The path to avoidance is clear and built on these pillars: stringent blood sugar management, controlling blood pressure and cholesterol, committing to your annual screenings, the eye exam, the kidney tests, the foot checks, and embracing heart-healthy living. You are not a passenger on this journey. You are the pilot, with your healthcare team as your co-pilots. Remember, I am a diabetic, not a doctor, and this video is for educational purposes only. It is not a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider, especially when making changes to your diabetes management plan. Your daily choices are your power. Every healthy meal, every walk, every blood sugar check, every doctor's appointment is a brick in a fortress you are building to protect your future self. It's a fortress strong enough to keep these dangerous complications at bay. Until next time, stay strong, stay sweet, but not too sweet, and keep thriving with the Blood Sugar Squad.